Tell me what your situation is. You're in a hospital that is primarily almost completely COVID-19, not all of the beds, and the ward you're on is all COVID-19, correct?
That is correct. I work in a 24-bed ICU, and basically every patient at this point is on a ventilator. We typically only have probably less than 50% of the patients on ventilators at one time.
Okay, and let's just be real honest here. You're the one that is there at the most critical moment. In other words, when it gets down to someone coding, someone that is stopping breathing, struggling to hang on to life, you're the one that comes with the crash cart. You're the one that's charged with attempting to resuscitate and do whatever you can to prolong their life if that's possible, correct?
That is correct. As my role as the rapid response nurse, I primarily work in the ICU. I have quite a bit of critical care experience. I think it's about 15 years now. But when they call a code, which is when someone's heart stops or if someone's having trouble breathing or any type of complication outside of the normal realm, they will call a rapid response.
In this situation and in others, but certainly in this situation where family can't be in the hospital, in the room, many times you're the last voice that patients hear before they pass.
That is unfortunately correct. And that's one of the things that bothers me quite a bit. It causes me a great deal of anxiety. What we do is we employ the use of iPads for these patients, and we have them contact their families when we get close to the point where they're about to go on a ventilator or sometimes at end of life situations.
I want to ask you a question that's maybe a little different. What I'm interested in is for you to take me through the night when you're by yourself after you've been through one of these often prolonged shifts. You've had to deal with this. You're now home alone. It's maybe the middle of the night. You're waking up staring at the ceiling at 3 in the morning. What are you saying to yourself?
So that does happen quite a bit. A lot of times, what I'm saying to myself is that I'm scared to death because I've been exposed a multitude of times throughout the day, every day. And I wonder if I have it. I wonder, sometimes I'll talk myself into saying, oh, I have the chills. Maybe I have a fever. I'm coughing. Do I have a sore throat or do I just need a drink of water? Did I bring it home to my child, my family, my loved ones? These are the things I worry about, or I make sure in my head that I've done everything correct for a patient that I wanted to do.
And you do everything you can, but you don't always get the result, and probably more often than not, the result that you want. And what does the risk reward ratio look like to you? Because you've got to be thinking that could be me lying there soon. I am coming home to family. I could be bringing this disease home. Um, how do you square that risk reward ratio in your own mind?
I'll be honest with you, quitting nursing or not going to work has never crossed my mind. It's what I do. I've been doing it for 20 years. It's half my life. And I truly couldn't imagine doing anything different. Yeah, there's risks, but like I said, it's what I do. I can tell you the COVID-19 is so new that a lot of times the treatment modalities that we choose for patients are merely a guess, an educated guess, but we've felt that I'm sure everyone in the medical profession has felt responsible for a death. I'm seeing more death now than ever.